Welcome to Guy Shrink. I'm Bill Roman, host here, and we're in our studios. Hey, we moved our studios from downtown Toledo. Now we're in suburbia, so to speak.
Look, suburbia.
Right, right. And my guest today is Dr. Richard Fernandez, who's a health care specialist. He's a doctor of physical therapy, as well as works for the city health department, or the county health department, right?
Mm-hmm. Yeah, I'm currently on the board at the Toledo-Lucas County Health Department.
And we're going to talk about men's health, at least get started there, and how to manage some pain, physical, which often is related to our emotional pain. So, Richard, it's great to have you here today.
Yeah, thank you for having me.
Yeah, and so I begin every interview with a question of, well, Richard, what keeps you awake at night?
I love this question. This is something that keeps me awake. It's also something that I try not to let distract me while I'm driving or distract me when I'm supposed to be maybe documenting on my patients, things that I will like meander into and Googling and looking for resources. This week, I've been thinking about identity. And something I think about quite frequently because identity, both me personally in my life, but also in the work I do, helping people manage pain problems, injury, rehab. You know, there's this distress in identity that we're always coming up against. And having a very static idea of identity, I think leads to, in my life, has led to inner conflict, external conflict, has impaired my growth in the past. And yeah, I'm always curious, like, well, what are people using to construct their identity? And Bill, you're a counselor and you know the psychological realm and the realm of the mind. So maybe I wonder what you think about identity. I forget if we've talked about this.
I thought I was asking the questions here, kind of thing. But what I'm hearing you say is that one of the things that toys around in my head is, what are the ways by which I construct my identity? And so that immediately says to me that you're thinking in terms of intentionality, that I have some intentional participation in creating my identity, as opposed to it's either foisted upon me, or, well, it's supposed to be this, or I give it no thought whatsoever, which many of us do. Sure. Thinking about, what are the ingredients of identity and personality.
Yeah. Well, I take, let's say, we're talking about men's health maybe today. I take a gentleman who walks into my clinic and has been working as a boilermaker for 35 years. And that is actually a real story. This gentleman tells me, my father was a Boilermaker. My son is becoming a Boilermaker. It's what my family does. This work that I learn is so physical. You work around extreme temperatures. You work around metals, and you're breathing in things that are impacting your lung health. But part of your identity is saying, I work hard. I do something not a lot of people can do. I'm useful in this way. I take care of my family this way. This is how I do it. And when I see folks who have come to near the end of their line of their physical capacity, things hurt so much that they can admit to me they don't know if they can do it anymore. Now they're coming into conflict with this near lifelong identity, this intergenerational identity. And for me to sit there, I can think, well, why don't you take a sabbatical? Why don't you work at a job where, my go-to is always like, you could bag groceries for a bit, and not in a demeaning way to say like, oh, I want you to go do something that you think is easy, but like, can we compromise, with the body? And if the body, to say that it's the body, not, to me, is separating the mind body as a complete thing, but to put simply, can we compromise with the body and figure out something that maybe would serve that a little more? But are you ready to change this part of your identity? And can it just be temporary? You can step away from this role as a boilermaker, an iron worker, or a factory worker, and it shouldn't be impossible to come back to it, right? But it's hard, and I don't thrust that on people. I wait for them to kind of open up that conversation. And I've had several people, you know, real big tough guys say like, you know what, I've been thinking about it for months now, and I think I'm ready. You know, it's that pre-contemplation. It's that, you know, where are you on that readiness for change? But, you know, a lot of times in the healthcare system, it's how ready are you to quit smoking? How ready are you to stop drinking soda or start eating healthy or start moving more with like exercise or activity? But that conversation of how ready are you to transform your identity, like these fundamental things that make you who you say you are, that conversation usually doesn't happen until it has to. And then it's tough. Yeah, and then it takes a long time.
Until pain might drive me to that place.
Yeah.
Like physical pain. You know?
Yeah.
And then I'm wondering, as you were talking, that was a beautiful illustration what you were talking about, is how many of us, our personality, our identity is grounded in being in pain.
Oh yeah. A lot, I think. You know, I forget the numbers, but you know, it for anyone who works in the painting population, we know a surprising large percentage of folks are suffering from, or will, or have suffered from disabling pain, right? It's maybe over 80% of the US population does or will have disabling pain that can last up to 3 months, and oftentimes longer. Meanwhile, probably just talking about back pain, like 2 out of 10 folks will actually see someone about it, right? It becomes this cultural norm that, oh yeah, my back pain, right? It hurts. You know, maybe I go see a chiropractor, or maybe I get a massage. Maybe I think that's not as common in the male population, but you know, maybe I look for a fix. Maybe it works, maybe it doesn't, but hey, life's got to go on. So I keep going on with this. And yeah, I think that's where identity comes in. It's what am I doing in my life that could be contributing to this? And what am I ready to change to see if it affects me positively?
Well, I'm thinking about, you know, in a locker room, there's a sign that says "No pain, no gain," or you know, push through the pain. And so it's almost I don't know whether it's a cultural thing, a guy thing, that ignore the pain and just keep rolling along or pushing along or whatever. Don't be a wimp. And so we may not see pain as a signal or an invitation to do some contemplation, at least, about some changes that might be in a whole different direction, like changing my whole generational career. But the whole idea of pain is something that you just endure. Yeah.
I think one of the big challenges, I get into semantics a lot, and I think words are very important, especially when I text and write, but also when I talk now, especially when I'm in like formal speaking settings. I err on the side of speaking more to define the words that we're using. Because when we say pain, I mean, what does that mean, right? I worked in Hong Kong for 3 months, and I don't speak any Cantonese. I speak like a little bit of Mandarin, and then I can learn a little bit of Cantonese. But I had to learn like 5 or 6 different words for pain in Cantonese.
Really?
And I had to sit down with my clinical instructor to kind of like tease out, okay, what are we talking about here? We're talking about like qualities, right? Or, I forget who coined the term qualia. Is that in your vocabulary? Qualia?
Qualia, no.
Qualia. Oh, I
want to write that down.
Write down qualia, and the next podcast we'll dig into it.
So does that mean should I Google it then?
We can, yeah. Well, okay. I don't want to go on record as not knowing words that I'm speaking. But
we'll delete that.
But what I'm, it's truth. It's honest. But what I'm kind of edging towards is this idea that, you know, we have these experiences, or we have these feelings of what it's like to be in a moment, and then we try to give it a word. And to give something one word like pain, it's like, okay, maybe that's like an umbrella term. And in my world, we try to use a specific definition that is constantly evolving, but it's coming from an international organization of neuroscientists, psychologists, medical doctors who are trying to kind of pin down, okay, what's a good definition, a working definition that a medical professional can bring to the lay population, maybe not word for word, but in how they practice, right? So backing up a second, culturally, I think we think of pain as just like something we don't like, right? So no pain, no gain in the gym. I'm pushing through fatigue. I'm pushing through a physical limit, and that's unpleasant because my body, my amygdala or my limbic system in general is trying to say like, hey, we're approaching a limit. You realize that, right? Like you realize that this body is a physical thing and it has a physical limit, right? The actin, myosin, fibers of your muscles and your ability to provide, the metabolic fuel for movement, it's limited, it's finite. And so our brain, as this great estimator, as this great, hallucinator, our brain, our mind is trying to help us figure out, well, are we close, right? And so no pain, no gain is that idea of pushing through the estimated threshold to discover kind of this higher ground, this new threshold, rising above these clouds. And then afterwards you get to say, whoa, I guess it's not so bad. Right. I did it. I ran that marathon. Yeah. I bench pressed my personal record. Cool. And then physiologically, as long as we rest and recover properly, then our actual physical capacity increases, but also our mind's estimate of what our limit is, that also changes. And that's very illuminating. And that probably is a big part of what's happening in some of the chronic pain population for folks who are actually experiencing improvement in their quality of life, right? So pain is this thing that we don't like, right? That could be no pain, no gain, and we could use that. But then we see someone in the medical setting where they've torn their rotator cuff, now they've had surgery, and the surgeon's like, look, re-tear rates are really high for rotator cuff repairs. We're going to protect this. You're going to go see physical therapy. They're going to guide you through what's next. But you've lived this life of no pain, no gain. It's like, I'm not going to baby this. I'm going to get stronger. But here we've got pain being a more reliable estimate of not just what's hard to do, but what's your actual limit, right? The thing that we're protecting, which is paining. When I say paining, as if like it's a live experience. Yeah. It's not a thing. You can't find pain, but you're in pain or you're paining.
I like the verb. It's a verb.
It's a verb. Yeah. That thing, the rotator cuff, that's a thing, and that can break, right? And your brain is trying to give you an estimate of that limit. And so pushing through that pain, it's high risk, very low reward, but it's that thing that can be really challenging when it's tied to your identity.
Right.
So this definition of pain that we use that's more general but helpful, I wrote it down before I came. It's from the International Association for the Study of Pain. And pain, an unpleasant sensory and emotional experience. I think the emotional component was added. This unpleasant sensory and emotional experience associated with or resembling actual or potential tissue damage. It is tied to the body, right? As much as we can understand in our human experience and human history, when we feel pain, something is or might be happening to the body. Yeah. Pay attention. Something's going on. And then it's that invitation, like you said. It's an invitation. Okay, can I assess here? Can I assess what's going on? Can I slow down? All right, so I'm on a roll here. This ties to kind of this cultural norm, especially in our country, this individualistic, progressive growth kind of culture we have, right? We want to grow more. We want to have individual success. We got to fight for ourselves, pull ourselves up by our bootstraps. This ties to this cultural norm of like, well, if you slow down, you start losing. All right. Less sleep, more work, harder work, more money, climb a ladder, right? And it's climbing ladders at all levels. We think of climbing ladders as this corporate thing, but my folks who work in their blue collar, hard physical work, you know, it's for people who aren't close to this. So for some people, this is everyday life. This is your dad. This is your mom. This is your, you know, but for folks who don't know, like even at a very ground level, like your reputation as someone who works hard is very important. Mm-hmm. I mean, I had like a 25-year-old woman who got in a car accident the day before her trial period at the Jeep plant started. And she's this little thing. She's a little boppy, sunny, happy little Latinx lady. And I could tell she had that personality. But when she saw me in the clinic, she was like, oh, my whiplash, you know, head to toe. And she's like, well, Richard, I start this job tomorrow. I'm like, oh. I was like, can they be accommodating? You know, what's our flexibility here? She's like, if I don't go, then they let me go. I don't have a contract. I don't have a job, like security. Like I get to work here for 90 days and then they'll consider hiring me. Right. Boom. Then I get benefits. Then I get, you know, a future. Then I know my life. Then I can start making other decisions, you know, because she had long-term wanted to go into, I think the security industry, right? She wanted to get a license and a degree and work in security. But this was a way to have some job security.
Yeah, right, right.
So she's like, I got to push through it, you know? And the body was saying no, but she was like, I got to do it. And so she kind of just bit down and she did it. And it was the structures around her that really obligated. She felt at least so obligated because life is complex. And I mean, there's,
right.
It can be hard to find a path that feels right.
Right.
And once you find it, you know, again, identity,
right.
It starts to become part of your identity.
Right.
And yeah, so then you push through the pain.
Right. Well, complexity, that's what life's about, but we can't handle that, so we simplify everything. Yeah. While you were talking, I was thinking a couple of things. I've been doing some reading by an author, Arthur Brooks, who writes for the Atlantic and New York Times, and he's written several books, and he's a social scientist kind of guy, and he was just talking about some research done on the diminishment of one's powers after age 40. And talked about the curve that your creativity, brain power, your ability to go with the flow diminishes.
I think about this. I thought about this week. I'm 34 and I keep forgetting, and I'm going to be 35, which means I'm halfway to 40 in my 30s. And I'm like, oh no,
it's all over.
I was like, I love my brain, but
he's making an argument for, and that's another whole podcast, for a second curve. He calls it a second curve, where you begin to shift away from success to significance. Now that's my phraseology, but talks about the actual diminishment of abilities. And then as you're talking, I'm thinking about, we don't like the word diminishment.
Right.
And that pain is a diminishing force in our lives. Yeah. And it becomes a problem. And then, and I was also thinking about many years ago, a doctor, I believe his name, Paul Brand, I believe is his name, wrote a book called Pain, The Gift Nobody Wants. And it talked about pain, of course, but the idea is it's a gift. And we were talking earlier before we started recording about surprises being an invitation into considering something I never would have before. Yeah. And I wonder what would happen if we begin to think in terms of pain as a surprise. I certainly wasn't prepared for it. Like say I'm doing some deadlifts or whatever, and I move in a kind of a bad way, and I either sprain or I could rotator cuff tear. And all kinds of things in the gym happen, and then next thing you know, I'm laid up for whatever. And what is this going to? What am I going to do in this? In this time when I might not be lifting or kettlebelling or whatever it is I'm doing, marathon, triathlete, and not seeing it as more as a disruption as opposed to a surprise that's inviting me to consider something I wouldn't have considered otherwise. I
had this conversation with someone earlier this week who also rotator cuff repair. She's a doer. She's a manager, a director of the people she works around. She gets things done at home. She's even on day one when she was in a sling, this arm in a sling, she was still kind of like keeping herself moving, because when she's sitting, she still needs to move, right? Think about those kids who we give them the little bouncy ball to sit on instead of a chair so that they can keep moving during the day. Like they need it, right? But it's that hard conversation of like, is there anything that isn't movement and physical exertion that has ever enticed you that you can bring into the daily life now? You know, whether it's reading a book or expressing an artistic curiosity, you know, this is that time, right? It's like you're on a car trip, you're on a road trip, and you have no choice but to fill your time. Mm-hmm. Are you going to listen to music? Mm-hmm. Are you going to sit quietly? Mm-hmm. You know, do you have the skills, right? And so this brings us to what I think a proper chronic pain clinic, but really just a good clinic that focuses on managing pain problems would incorporate, and the good ideal clinics out there are doing it, and they're incorporating mindful practices, seated internal mindful practices such as meditation, breathing, eating meditation, these kinds of things, and then slow conscious movement practices that are not about building muscle. It's not about succeeding in some sort of, you know, monumental physical kind of comparing way, like, oh, I'm getting stronger than my past self or stronger than so-and-so. It's merely about being with yourself. Mm-hmm. And then once you're with yourself in this more profound and conscious way, then you might find out those other things that you thought you needed all the time were more bells and whistles.
Yeah.
Right.
Yeah. Yeah. Just in the end of last summer, I must have done something. You know, I was on a roll at the gym and really doing well, and I felt great. And then my left hip started bothering me, and I thought, oh crap, you know, I'm, you know, old age, you know, mm-hmm. hip, I'm going hip replacement, you know,
yeah.
all this kind of thing. And I'm talking to the wrong people who are saying, oh yeah, go, you know, and I got to the place where I actually had to like use a cane. I thought, oh, this is horrible, you know?
Yeah.
And so begin, what am I going to do? So you go through the medical thing. Yeah, well, yeah, you know, you talk to surgeon, you know, we should do shots, blah, 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 you know, and all that sort of thing. And I'm kind of going, is that, if I did the surgery, I said to the surgeon, how soon could I get back to the gym? That was my question. Mm-hmm. And I thought, now that in our conversations that I've had with you, I thought, that was a dumb question to ask. You know, instead of saying, what is this inviting me to consider?
Yeah. You
know, now as it turned out, you know, did some physical therapy, did some other stuff.
Yeah.
And while I'm not back to where I was per se, is vigorous, I'm a lot better. And two things, didn't do surgery.
Yeah.
And second thing is I didn't do any pain medications. You know, because those are two options that you usually get: do surgery and medication, either injections or take some pain pills or something like that. And then I moved to maybe I should consider more about what's all this about for me anyway.
Yeah.
What is this inviting me to consider? You know, my wife keeps telling me, you know, quit thinking you're 25 again.
Yeah. Identity, right?
Exactly, Richard. You know, identity.
Yeah. Our physical body is always changing, right? Like our red blood cells, I think, got like 30 days, you know, our skin is flaking off and creating all this dust around us. Our hair is falling out and coming back, hopefully. You know, it's like heart cells and your eye cells that don't die and go away, right?
Is that it?
And there may be a few other things, but, you know, this body is turning over, you know. We've got bone reformation constantly, you know. I've done these seated meditations with myself where I sit and I try, you know, my background's in cellular and molecular biology. I've taken anatomy 3 different times, like U of M, University of Toledo, University of Illinois, Chicago with their med school. Like, you know, I've taken physiology, anatomy, and neuroanatomy. And I'll do these seated meditations where I sit and I contemplate all of the movement happening in my body when I'm grossly still, right? All of the, you know, moving cilia, you know, my moving cells, my actin myosin, you know, of my muscles making tiny adjustments, all of the, you know, transcytosis of cell movement, right? Like you know, a microscopic cell itself is having all this movement. And so, you know, I have this body that's going through all these processes and I'm not in control of it. I can influence it, right? I'm an environmental factor to my own body.
Yeah. Yeah.
And it will go on how it goes on, you know, like a plant, like a tree. It's just a little more complex because we're thinking things, you know, we are thinking things here. I forget where I was going because you were leading me to kind of thinking about our body changing. Yeah, we're not who we were yesterday. We're certainly not who we were 30 days ago, and we're definitely not who we were when we were 12.
Yeah.
Right.
Yeah.
And so where along the line do we say I've changed, or am I just always changing? And
Richard, would you say a little bit more about mindfulness and meditation as not a pain alleviator, but maybe a tool in managing?
Yeah, I think that's important. And I'm not an expert in this.
Could you deconstruct mindful meditation a little bit?
Ooh.
Just kind of like how you use it and how you practice it.
Sure.
And kind of get it away from I got to become a Zen Buddhist monk or I don't want to do that or whatever.
Okay. So this is why maybe I'm a good person to ask about this. I am your everyday person.
Yeah,
I'm not a Zen Buddhist master. I've dabbled in reading in Buddhism. I've, dabbled in taking meditation and mindfulness courses, Toledo Mindfulness Temple. I took their kind of secular mindfulness course and learned some Zen Buddhist breathing meditation skills. And Sam Harris has an app for training in mindfulness, and I've appreciated that as well. It's called let's see, Waking Up is his podcast, and his app is, well, I don't have to plug it, but it's a good one. So being a non-expert, my exposure to mindful practices has been through seated meditation, Tai Chi, and dance. I haven't brought that up. I danced up through college, and I still dance as much as I can. And what I've learned is that there's this mode of being during which we have this enhanced awareness of movement, of position, and then of our mental state. And it's just a matter of witnessing ourselves. It's a practice of witnessing ourselves and not going on that ride or grabbing onto and riding along the coattails of our emotions and our feelings and our whims, or at least noticing when we're doing it and then making decisions at those points of, is this what I want to do?
Yeah.
And once you practice that enough, once I've practiced it enough, I've gotten really good at noticing in myself, but also I think noticing in others when I or someone else is kind of riding along a tangential thought or feeling, and that wasn't the original intention. And I think that ties to identity as well.
Yes.
Yes. A mindful practice leads to this opening up of what is my identity. It can help me detach from all those feelings, right? And detaching from my feelings doesn't mean rejecting them or hiding them. It means like just looking at them. If I'm like angry in a moment, do I have that practice of saying, oh, look, I'm angry. Here's anger, right? How long is that going to be here, right? And can I use it right now? Do I like this feeling? I really don't like the feeling. I've really in the past 5 years really learned that I don't like anger. I don't like jealousy. I don't like everything that we call like these negative emotions or feelings or perceptions. And so then I can look at it and say like, well, I'm gonna like at least let that go. And if it comes back, okay, it comes back, like it'll rain. I can't control it. But I can kind of choose my next action, my mental action.
Well, you really slow the process down when you do that. The energizing process of emotionality, acting out on the anger. If I thought, oh, I'm really feeling angry right now, you just slow that whole thing down. And of course, so much of our problems are caused by our impulsive actions. Impulsive means I didn't think about it. It's kind of like ready, fire, aim. A kind of thing. Yeah.
And you can practice doing that. Like you can practice being impulsive. Like I played soccer and I practiced reacting instead of thinking.
Yes.
I was terrible at soccer when I thought too much.
Yes.
And then I got better when I just said, oh, forget it. Just go play. I don't care if I win or lose. I don't care if I do well. I'm just going to play. and then I did well.
Yeah, interesting. Interesting. I like to pursue the thing about dancing for a minute.
Sure, yeah.
You know, as a kind of contemplative practice. A couple podcasts ago, a buddy and I talked about golf as a spiritual practice, and dancing as a spiritual practice. Because in some of the research that's been done in pain management in Boston, particularly, The Body Keeps the Score, that wonderful book by Bessel, whose last name I can never remember, the Dutch psychiatrist, but that's a phenomenal book. But one of the ways that he uses in his clinic in trauma, because the body remembers trauma, that's pain, that's emotional pain, trauma, and it's rooted really deeply in one's identity, is he found that dancing was one of the ways by which the patients, and he deals a lot with kids who have been emotionally traumatized by watching people get murdered, killed. I mean, we're talking about kids in really unsavory neighborhoods. And that dance was one of the things that really helped those kids get past that emotional pain. I got it taken care of. It's a way to incorporate the pain in one's life and did not allow the pain to be the primary identifier of who they were. And it was dance, movement.
We live in this language world because for the most part, most of us are using language to interact, both with other people, but also with, like, I guess, anything that has like substance and meaning, right? Or even deeper, I think Aristotle, was it Aristotle? Socrates? I forget. I took a class about literature and what English, or like what literature is, like what's a word, you know? And like this mug is not a mug, it's a thing. And I have a word that's mug. And I use that word as a placeholder for what this is. This is just this, right? I'm holding a mug and it's the color it is, it's the shape it is. I experience it the way I experience it. Who knows what it really is? I mean, it's atoms that aren't even touching each other. They're just really close and they're bonded. But I have a word for it. And then that word has a lot of power. And so all these words we use have all this power. But then when you start practicing moving in response to whatever moves you, you know, you are using something that's non-language, non-verbal language, right? In the academic dance world, you know, we're building vocabulary and we're building language. There's movement language, you know, any dance company will inevitably create a vocabulary and a language of movement. And it's layers and layers, right? Ballet is a really, really simple entryway into what dance language can be, because you can have first position, you can have second position, right? With your feet, with your arms, and then you can have different movements, and then you can use that to create phrases, and those phrases can create entire compositions, and you can add music, you can add text and spoken word and staging. But as far as movement goes, that, you know, that kind of idea of positions, that's just one layer. You also have intentionality, emotion, you have interpersonal connection, you know, how bodies move in relation to each other. And as you start to explore that in any formal or informal way, I believe, you know, you're practicing experiencing life without that language that you've used for so much of your life. You get to exist in a different realm. And I know for me, when I'm really in that flow state of dancing, right? I think a long time ago, that book about the flow and the flow state came out. Surfers experience it, golfers experience it. You're not thinking, you're doing, and miraculous things are happening. You're hitting this tiny little ball into a tiny little hole. Who cares why you're doing it? That makes no sense. But you're doing it, and you're doing it with this like stick. It's absurd. And people get really good at it. And they do it without, in the moment, thinking about every little thing that they've done. And in dance, without any experience, without any practice, right? Without any goal of being good or putting the ball in the hole, anyone can have that invitation to enter into a flow state where they separate from language, from good and bad, and then it becomes a type of truth. And I think that's a lot of this tough life of living in pain is, you know, what is the truth here? You know, what, because you said earlier, like, I forget if we were on or not, but, you know, trying not to ask your clients why all the time, you know, why do you feel this way? Why'd you do that? But yet we entertain these ideas of like, why am I in pain? What's causing it? What's broken? What can be fixed? And it's sometimes, well, inevitably we're barking up the wrong tree. At some point we have to say, hey, it's been like this for 20 years. You've seen 20 experts. Nobody's got the answer, although they want to, right? And they're using whatever knowledge they have, always limited, as profound and robust as their knowledge can be. So how about we start asking some different questions at least once in a while? Like, what are we going to do next? What do you want to do? And how can we do it? And dance, sure, is going to be one way of doing that. And one of my favorite dancers who passed, unfortunately, in the past year, well, she passed. I won't say unfortunately, we're all going to pass. But Anna Halprin, she was a dancer. She led a company. And then she eventually had her own experience of dealing with cancer. And once she was gone into remission long enough, you know, her oncologist said, hey, you're good. You know, you're healthy, no cancer, blood levels all good, no signs of, you know, of relapse. And she's like, okay. She's like, why don't I feel good? And they're like, well, we don't know. Like, you should feel fine. Like, everything's great. So she went on her own exploration to use dance and art, you know, painting, music, rhythm, breaking out some bongos. She used that to explore, well, what's going on within me. And then she was healed fully.
Wow.
Right? And she doesn't dismiss the medical miracle of being able to deal with this cancer that was taking over her body. But she didn't then feel whole yet until she had that internal exploration. And that turned into a whole program that people across the country and maybe around the world participate in. It's dance as a healing art. And you get folks who are recovering from cancer, living through cancer, using movement to feel more whole and to discover parts of themselves that are good and give pleasure or catharsis. I wonder if
giving pleasure and catharsis, if they are not also healing mechanisms, you know, beyond medication or whatever. Just the idea of feeling, you know, catharsis, cleansed. That's what that means, and having pleasure into my life. That's just as powerful as taking a medication.
Yeah.
Wow, that's a profound idea. I never thought of that.
It's returning humanity to what has otherwise been co-opted. I'm using an aggressive word there, but returning humanity to what otherwise has been taken over by the medical realm. Right? The medical world is doing amazing things, but we can't all be specialists in absolutely everything. And there's a humanness that I think we're moving towards in the healthcare industry and in certain pockets of healthcare, which is to incorporate the full humanness. Right? That's what the biopsychosocial model should be, you know, incorporate the biology of the body, the psychology of the mind, and being a thinking person, and the social aspect of being a person in relation to other people. All of these will affect something. All of these things will affect everything at least a little bit. And this gets to some of the neuroscience of pain and understanding pain, which asks us to think of ourselves or our identity as being not just here along with what is here, but we're embedded within it. Like, our skin is not the end of ourselves. You know, the amount of influence we have from, you know, our surroundings, both socially, verbally, visually, you know, just, I mean, we know that like UV light can be good until it's not, right? We know that oxygen's important, right? We know that other gases can be toxic. So, okay, I'm in relationship to that, you know, the air in me, is it me? As I breathe it out, is it still me, right? You know, I have blood in me. You know, if I get a paper cut and some of that blood comes out, when does it stop being me? And then how much of me do I lose before, you know, I'm me or not me? And this is what keeps me up at night, which is identity. Where am I? Where is the me? Right?
Yeah.
Right.
Now you sound like Walt Whitman. I'm many. I can't remember the Song of Myself. He talks about.
Yeah.
And even I was just listening to somebody talk about Rana Maria Rilke, a great German poet, talking about a similar idea. I'm circles.
Yeah.
I'm involved in circles.
Yeah.
Kind of thing. And and I like what you said about the social way. That's often not thought about. You know, biophysical, social, that's biopsychosocial.
Yeah.
That we're embedded in relationships. You know, someone comes to see me. It's an individual who's got an individual problem.
Yeah.
And no, our problems are not individual. Our
Yeah.
problems are, so to speak, are corporate. My pain might also be some kind of social phenomenon, not just me.
Yeah.
You know?
Yeah. A lot of the public health research that looks at things like, you know, family history of chronic pain or low back pain. Let's use low back pain because it's hyper simplified and it's not a simple thing, and we may never fully understand it. But, you know, there's research that says, you know, if your mom had really bad low back pain, then you're probably going to have it. And then, you know, in the scientific world, we kind of stick to that biological realm. We think, oh, what is the genetic inheritance? You know, what's the neurological factors? You know, what's the immunological factors? And it would be a whole nother realm of research to say, okay, what are the social factors here? You know, how do beliefs and practice influence our experience of pain? You know, if pain itself is an unpleasant sensory and emotional experience, and it has to do with actual or potential damage, right? Like, then estimating potential damage and experiencing, you know, a problem state of the body. You know, why can't that be strongly influenced by what we grow up with? Absolutely.
We talk about genetics and we think only in biological terms, but I see it as emotional terms. Every family is an emotional unit.
Yeah.
And I learn how to navigate life in my family. And you know, if mom had chronic pain, I'm not saying I'm going to have chronic pain, but I'm going to know something about it emotionally. I think you're onto something extremely important, but it's often not thought about.
Yeah. And then I got to say this too. And again, I'm representing, I'm trying to represent all the myriad of amazing, brilliant people who I learn from. And then I can't probably speak as well as all of them, but something I think a lot of my cadre out there would kind of highlight too, is this, you know, when we kind of parse through these possibilities of how pain can emerge, you know, some instinct in some of us might be to say, oh, well, you're saying it's not such a biological problem. There's a social and psychological factor here. So then it sounds like it's not as important, right? Because culturally in our medical culture, the biological factors are supreme, right? As opposed to being a joint circle, it's like, okay, if your heart stops, everything's done, right? So the biologicals must be the most important. Versus, you know, if I have a heroin addict who lives in a home with other heroin addicts, heroin might not be the main problem. Being surrounded by users becomes the main problem.
That's correct.
So now the social factor is supreme.
That's absolutely
and it shifts. And but then when we get to pain, if we can start to change our definition of what and how pain emerges, then we can be okay with shifting the more supreme factor to social or psychological without demeaning the profound suffering that comes with it. And that's, I think, what a clinician has to grow into, is how do you present these ideas both to the client, the person in pain, but also to your fellow medical community to say, there is a reason we can focus attention on these things, and it's a good reason. And it relates to the science behind this emergence of this pain experience.
Yeah.
If all we think is it's, you know, you have back pain, well, you either had a disc problem, an arthritis problem, or you tore a muscle or a ligament problem. It's like, okay, well, what about when the MRIs show everything's fine? Okay, well, okay, it was a neurological problem. It's a nerve problem. All right, we gotta, you know, do a nerve ablation and burn the nerves down there, and then we gotta, you know, whatever. Okay, so then we're gonna change diet, and now the immune system is improved. It's like, well, what? Okay, what if that doesn't work? So, you know, there's this rabbit hole, and I would love to fast forward so we can quickly go down that rabbit hole instead of taking decades, so that we can get to valuing some of these other things.
Yeah.
Like, you know, how do we support a person in pain without you know, demeaning the experience? Because it might be like, hey, like, you need new friends.
Yeah, right. This has been an
Right.
absolutely fantastic conversation. So I just kind of feel okay. We'll wrap up with just one other question. Is so you got there's, you know, the elevator speech, I always call it. So what might be your elevator speech to guys right now that are staying awake at night, you know, wrestling around with some pain?
With pain problems, I think my message is that you may surround yourself with experts in their areas, but ultimately you are the center of your experience, and you have the unfortunate but useful responsibility of trying to put all that together, and that your life experience is probably the most important aspect of your recovery and of your life improvement. And although there will be many people around you telling you this is what you need to do, it's going to be on you to put it all together and make the right change. And a little more trust in yourself might go a long way.
Well, thank you, Dr. Richard Fernandez, for a great conversation about pain, the gift nobody wants. So thanks for being on Guy Shrink.
Thank you for having me.
And to our listeners, stay tuned for some more good things that we have coming up in the future.